Tell me about getting involved in androgen deficiency and all matters testosterone.
For me, the story started with diabetes, and a lot of diabetics have low testosterone, as well as other testosterone-related issues, for example, erectile dysfunction. And it was that realization that led me to conclude that testosterone was, in fact, a much overlooked and very important area, and really needed a little bit of study to bring it to the fore and to treat those men who are very obviously in need of treatment.
Give me some ideas of the sort of studies that you've been involved in.
We've looked at a wide range of things. We've looked at surveying men to see what are the causes of testosterone deficiency, and that was very interesting. It highlighted a number of unexpected areas. We've looked at the validity of androgen measurements. So you take the measurement in the evening, it'll be different from the measurement in the morning. If you smoke, there will be an effect. Simple things like that, but they make all the difference in terms of categorizing people correctly.
In terms of treating this condition, we talk about testosterone deficiency. How do we detect it? How do we treat it?
Well, it's principally in likely people. In other words, we're talking here about middle-aged men, although not exclusively. And they tend to just flag a bit. They're down maybe 50% of what they were. So they become tired, they become a little argumentative, they tend to sleep easily, they can't concentrate, they have difficulty with their job. These are nebulous, somewhat non-specific circumstances, but when you put it together, it tends to produce a clinical picture which is then backed up with measurements, and then we often have a trial of therapy to see if that helps, and we move on from there. The treatment paradigms, the treatment examples have been fairly well worked out, and have been endorsed by quite a lot of UK societies recently, and that's been a great help in advancing this area.
We understand from your research of 10,000 men that as many as 20% may be living with this condition. Is that true in your clinical experience?
I would say so. It's an astonishing figure, isn't it? I mean, I'm really surprised by it too. But I think what has happened is this is a condition which has been around for a while, and we're only starting to uncover it. And that's very common whenever you come across a new area of medicine. And this is really a new area of medicine within the last 10 years or so. So the numbers do appear to be high. Now, we would look at it in terms of the men have symptoms, and then they have altered biochemistry. And we really need those two things to come to a diagnosis. And we have a certain number of careful things that we do to ensure that we have the right diagnosis. But yes, 20% is an astonishing number. But of course, as we now live longer, and as we do more, and as people work longer, then there are extra pressures, and that means that these deficiencies come to the fore because people can no longer cope when they're under this sort of pressure.
There's a certain amount of resistance to the medical profession in particular, understanding and treating this condition. Why is that?
I think medicine is conservative, and in many ways that's an appropriate response because we don't want to be rushing off to do every new fad. But now testosterone has become really quite well recognised, and I think we're at a point where medicine as a whole is starting to change and starting to realise that there is a new condition and it does need to be looked for and it does need to be sorted out.
A certain amount of cynicism towards this area and polarised views. There are those that say treating with testosterone is storing up problems for the future. There are people that say that it doesn't exist, but if it does exist, then in a very, very tiny amount of people. Is that your experience?
No, not at all. This is an eminently diagnosable condition. It can be treated safely. It can be treated for relatively low cost. It does depend a little bit on the treatment you use, but it can be relatively low cost treatment, and the treatment is very effective. You do require lifelong monitoring, and you do require to be seen by somebody who has experience in the area. But with those caveats, I think that this is a condition which is eminently responsive to treatment, and the benefits are huge in appropriately chosen subjects.
You talked earlier about making careful steps in terms of making diagnosis. What are those careful steps?
Well, we have to be very careful that we haven't got a contraindication to treatment, and that really is two in number. First of all, breast cancer in men, which you appreciate is relatively rare, and secondly, prostate cancer in men. So we have to be just very aware of these two areas. Then on top of that, there are other conditions that you just have to look for, concomitant conditions, conditions that occur alongside a low testosterone. So for example, brittle bones in osteoporosis, heart disease, diabetes, anemia. So these are mainline general medical conditions that are associated with a low testosterone, and they need to be carefully sought out and appropriately treated.
There's a school of thought that says that testosterone treatment actually increases your risk of developing prostate cancer.
No, I think this is a misconception which came from really the Nobel Prize winning scientist in, I believe it was 1936, and he determined various aspects, but he was looking at different things, and so this misconception, this myth has persisted. There are a number of myths about the subject, and that's why people who are experienced in the field should be the people who take on this work. And we have a big role to play in education and in monitoring and in gathering more information and research, and that's absolutely vital and part of what we do.
Talk us through some of the classic myths and misconceptions about testosterone and testosterone deficiency.
You've mentioned probably the biggest one, that testosterone can cause prostate cancer, and it can't, and there's a large amount of work which supports that, and every urologist that I know in the country and every physician I know would be pretty much of the same opinion. So I think that one is being put to bed and being put down. Then we have the question that testosterone will turn you into a raging bull, if you like, that it will make men more aggressive. In fact, the reverse is the case. When men are treated appropriately, they tend to calm down a little bit, they start to remember things, they start to behave more normally. Then there is the myth that it costs a lot, and that really just isn't the case. It does depend a little bit on the treatment. You can go for very costly treatment, but it's easy to treat men with a relatively cheap method of treatment. There are then other associated conditions that people talk about, but they really don't exist, and it isn't a problem. So these myths are slowly being dispelled, and I think that that's just part of the process of a new medical condition coming along.